Every time you lift your phone, twist a jar, or pick up your baby, a sharp, stabbing pain shoots through your wrist and thumb. You tell yourself it's just a strain, maybe from overuse. But as the days go by, it only gets worse. What's going on? You might be dealing with something called Quervain's Tenosynovitis, a painful condition that silently affects millions worldwide, especially those who spend hours scrolling, texting, or typing. Today, we're breaking down what it is, why it happens, and the simple fixes that can bring relief before it turns into something serious. Imagine this. You're trying to open a jar, and suddenly it feels like someone stabbed the side of your wrist. You drop everything in shock. That pain, right along the base of your thumb, isn't random. It's a sign that the tendons running through your wrist are inflamed, and that inflammation could be warning you of Quervain's Tenosynovitis. But the real shock? It's not just athletes or laborers getting it. Even new parents, smartphone users, and office workers are finding themselves in this painful trap. Imagine this. You're trying to open a jar, and suddenly it feels like someone stabbed the side of your wrist. You drop everything in shock. That pain, right along the base of your thumb, isn't random. It's a sign that the tendons running through your wrist are inflamed, and that inflammation could be warning you of Quervain's Tenosynovitis. But the real shock? It's not just athletes or laborers getting it. Even new parents, smartphone users, and office workers are finding themselves in this painful trap. Quervain's Tenosynovitis may sound complicated, but it's really about two key tendons that help move your thumb, the abductor pollicis longus and extensor pollicis brevis. They run side by side through a small tunnel in your wrist. When you use your hand repetitively, like texting, typing, lifting, or twisting, the sheath that surrounds these tendons becomes irritated and swollen. The result? Every movement of your thumb feels like grinding sandpaper inside your wrist. Doctors first described this condition back in the late 1800s, but it's more relevant now than ever. Why? Because of our lifestyle. Think about it. Constant phone scrolling, gaming, or typing. We're using our thumbs more than any generation before. That's why some experts now call it texting thumb or mommy's thumb, since it's so common in new mothers who repeatedly lift their babies. Symptoms usually start subtly: stiffness in the morning, a dull ache on the thumb side of your wrist, or a twinge when gripping objects. Over time, it progresses to sharp, shooting pain that radiates up the forearm. You might even notice swelling, a snapping sensation, or weakness in your grip. A simple test called the Finkelstein test, where you make a fist with your thumb tucked inside and bend your wrist toward your pinky, can reveal the telltale pain of this condition. But here's the good news: most cases don't need surgery. Early intervention can work wonders. The first step is rest. Give your wrist a break from repetitive tasks. Ice therapy for 10-15 minutes several times a day can calm inflammation. Wearing a thumb spica splint keeps your wrist and thumb stable, allowing healing to begin. Gentle stretches and strengthening exercises can also speed up recovery. One simple stretch: rest your arm on a table, hand hanging off the edge, and slowly move your wrist up and down. For strengthening, use a soft stress ball or a light resistance band to gradually rebuild stability in your wrist. And don't underestimate ergonomics. Adjusting your phone use, keyboard height, and wrist posture can prevent recurrence. If pain persists beyond a few weeks, consult a physiotherapist. They can apply ultrasound therapy, friction massage, or teach specialized exercises to restore smooth tendon movement. In severe cases, corticosteroid injections may reduce swelling quickly, and only a few rare cases require surgery to release the tendon sheath. Quervain's Tenosynovitis might start as a small annoyance, but if ignored, it can turn simple daily tasks into painful challenges. The key is awareness, knowing the signs, taking action early, and giving your body the rest and care it needs. So next time your wrist aches after scrolling or lifting, don't shrug it off. Listen to your body. It's asking for help. Take a break, stretch it out, and protect your hands. Because once your grip is gone, you'll realize just how much those tiny tendons do every single day.